Alright, I'm Ray. I'm from Professor Lukawski's class, Section 9. I'm demonstrating how to administer drugs via Piggyback. So the first thing you would do is standard protocol. You check the doctor's orders, you check the medication, the dose, the route, the frequency, any pertinent labs and allergies. And what we're going to be given is Rosefin. It's ordered for 1 gram. We have 500 milligrams per milliliter handy. It is a antibiotic for treating respiratory infections, urinary tract infections, and skin infections. And so what I would need to do, the patient doesn't have any necessary allergies. So I would wash my hands, and I clean this with a alcohol swab. I need to drop 2 milliliters because that's what's ordered. And I do a calculation to figure out the drop rate that we need. We would need to go at 17 drops per minute because our drop factor is 10 drops per milliliter. So then I would add the Rosefin to the Piggyback bag, and I would clean the end of the bag off with alcohol swab. That's the only thing I forgot. Jack that in there. Scoop the needle back on. Dispose this in the sharps container. Alright. So now I need to add the tubing to the Piggyback bag. Alright. And I'm going to go ahead and prime this now. Alright, and there it goes. So then I would clamp it back, and then I would bring this, and I'd, well, before I left, I would label the medication, the amount, my initials, the date, the time, and the patient. And so I'd go into the patient's room. I'd go ahead and hang this up, introduce myself. I would explain the drug being given, that they're getting Rosefin for pneumonia. Ask them if they have any allergies, identify them with their armband, and ask them to verbally identify themselves. And I would wash my hands and put on gloves. And I would go ahead, lower this down. Alright. And I would palpate their IV site, make sure that everything's okay, that there's no sign of phlebitis or anything else going on. No swelling, no pain. Then I would clamp my tubing for the primary IV. I take an alcohol swab and clean the port closest to the IV, or closest to the primary. And I would go ahead and add that on there, and I would unclamp the primary, or unclamp the piggyback, and then unclamp the primary, and I would wait a second before leaving to make sure they're not having an allergic reaction to the medication, and I would come back and check to make sure that they're not having an allergic reaction. I'd make sure that this was flowing at 17 drops a minute, and then I would document after leaving the room, and I document the time that it was receiving, that they got 2 milliliters, 1 gram. They're getting it IV via piggyback, that the IV site is in good condition, and the volume of liquid that is being infused. And that's it.